And the U.S. is fighting a new surge of coronavirus cases. An internal health and human services memo obtained by ABC News says 44 states and territories are now reporting an increase in cases. In Florida, where more than 16,000 people have already died from the virus, new daily cases have doubled in just 1 week. And with cases on the rise as we head into the winter months, many of us will be forced to spend more time indoors. Some experts are saying the next 6 to 12 weeks are going to be the darkest we have seen yet. So how can people effectively conquer this pandemic winter? I'm joined now by psychologist Dr. Sanam Hafiz and ABC News contributor Dr. John Brownstein. Good morning to you both.
Good morning.
Dr. Brownstein, we know that this virus is highly transmissible indoors. As we get ready for the holidays, people want to gather with family and friends. Is it possible to do that safely inside? What's your advice?
Yeah. Clearly from the beginning of this pandemic, we've been very worried about large indoor gatherings. And we've seen these issues, after every major holiday where people get together inside, that's when virus spreads. So, what can we do to have a safe Thanksgiving? Well, we got to prepare. If you really must, spend time with your family, then quarantining for a couple weeks ahead will make sense, because that way you can guarantee that you're not bringing the infection home. Obviously, limiting the numbers of people that are gathering is super important. Mask wearing, social distancing, all the things that we've been talking about. And then on top of that, ventilation. Do you have good air filtration in the home? Can you open the windows to let circulating air? All those things will serve to reduce risk around virus transmission. But of course, the safest way is to celebrate virtually if you can.
Well, and Dr. Hafiz, on that note, we know that isolation makes you safest from the virus, but it also makes you more vulnerable to mental health issues. A recent study revealed that depression rates have tripled during the pandemic. So how do we cope with these feelings, especially as it gets colder, as it gets darker, and we lose the ability to socialize outside?
It's a really good question. I mean, the study is very telling that 1 out of 4 Americans are now experiencing and reporting symptoms of depression, which is a really high number if you think about that. It jumped from 8% before the pandemic to about 28% now. So this isolation, this ongoing pandemic is definitely taking a toll on mental health. So there are ways to do it. As the doctor just said, if you can do it indoors and very safely, obviously, that's an option, now that our backyards are not going to be as usable and we can't just go have picnics in the park. I mean, in New York, especially, the winter months are, they can be brutal. There are ways around it. You can set, Zoom calls with your family and friends. You can have, instead of saying, let's catch up, actually put something on your calendar. One of the things that I tell people who are lonely or really missing their family and friends, I talk about maybe adopting a pet, having someone else to care for, to look forward to, having that unconditional love. The fact that depression is so high, I don't think you necessarily need to feel like you have to have a reason to seek out a therapist. Therapists are available doing virtual calls more than they ever have been before. So take advantage of that. And one of the things that we talk about is seasonal depression. It's a real thing. And so something like light therapy, just getting a lamp, or even one of the things that I've been thinking about is if you're working from home, maybe you can ask your boss or your supervisor or whoever you work for a later start date. So you have maybe an hour or two in the morning to maybe go for that jog or a walk and just get some vitamin D.
All right, good tips. And what have we learned about the way this virus spreads that we didn't know back in February and March when this all started? And how do you think that might change our approach this winter, Dr. Brownstein?
Yeah, I mean, we've learned a lot. I mean, this virus is new. It's not even a year old from our understanding of the epidemiology. And so the science changes. So, we've learned that cloth masks actually do work to prevent, spread of the virus. Reduced mobility helps. Indoor gatherings contribute to the spread. We know that the spread happens via respiratory droplets, but also aerosols. So that's why indoor ventilation is so important and why aggregating inside can be so important to transmission. Super spreading events, we know those are a big deal. Clearly what we saw at the White House. We also know that kids do play a role, maybe not as strong a role as adults, but they play a role in disease transmission. That being said, we know that schools can open safely, and we're seeing many schools doing so. So increasing our ability to open schools while focusing on high-risk areas, right? Indoor restaurants, places where we know that poor ventilation and people coming together results in disease spread. We also know that testing, so the more that we can improve testing in the community, that can allow us to isolate and trace contacts and allow limited spread in the community. And what we're seeing also is micro-targeting. So it's not just blanket intervention efforts across an entire state, but picking neighborhoods where you're seeing high intense transmission and focusing on those places so that not the entire state is sort of under some form of intense interventions. And so with that, we think that we can move forward this winter without major rollbacks in sort of reopening.
All right, and Dr. Hafiz, it's hard to experience these emotional repercussions that we're talking about yourself, but it's another thing when you see your kids struggling. What's your advice to parents right now?
My advice is, to go easy on yourself and go easy on your kids. It's been such a trying time for adults. And imagine these little children who are suddenly being ripped out from having play dates and in many cases still not going to school and remote learning. But they are very, very resilient. Well, one of the things that I really encourage is that parents have honest, candid conversations with their children, given their age and developmental level, of course. Don't, I guess the funny thing to say is like, don't treat them like children. Have real conversations with them because they have questions. And one of the things that provokes a lot of anxiety in children is the unknown. So tell them what to expect. Tell them what things are going to look like in the next few months. Tell them that we know a lot more about this virus than we did a few months ago. And there are certain things we can do to protect ourselves. Keep your anxieties and your worries, which as parents, we all have them, somewhat to yourself, because your children pick up on your anxiety. They pick up on they have this sense of, if my parents worried about something, then I must be worried about something. Be more affectionate, be more kind, spend more time with them, take advantage of the time that you have together, and find creative outlets so they're not on their iPads all day. Plan, if you have a backyard, plan a camping trip, a small one, doesn't have to be a big deal. Do take hikes, play board games, engage them in Zoom calls with your family and friends so they stay connected. So there are definitely ways that you can engage children in a way that is not as anxiety provoking or depressing and still doesn't make them feel like they're completely cut off or isolated from the world.
And what about those of us with really little ones? I have my mask here right next to me. As soon as I'm back off camera, I put it right on. My son sees us wearing these all the time. He's about to be 2, so he's about to have to start wearing him himself, and trying to get him used to that has been really difficult. How do you get the little ones used to wearing a mask?
Still talking to them, even though he's 2, you can try to explain it to him and say, this is going to keep us safe, and then reward that behavior. Positive reinforcement is the most potent thing out there in terms of if you give him a big hug or a kiss and say, good job, buddy, keeping that mask on. Good job not touching your nose. All these things. I have 5-year-old twin boys. And trust me, in the beginning, it was, I hate this mask. This is so hard. And I'm like, but you guys are keeping yourself safe. You're keeping other people safe. And my mom lives with us. I'm like, and you're keeping your grandma safe. So children recognize some of these things and it makes them feel important. It makes them feel special. It's definitely a challenge. I think as adults, it's a challenge to keep a mask on for extended periods. So, understanding and cutting them, some slack is important. But again, reinforcement, high fives, snacks, rewards go a long way with the little guys.
All right, Doc, it's an ongoing process. I will keep you updated, but I appreciate the advice. Dr. John Brownstein, Dr. Sanam Hafeen, we appreciate your time this morning. Thank you.
Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.